Welcome on this really blustery night. We finally got rain. Hooray! And, I was loving that sunshine. My name is Alison Holcomb. I'm the Campaign Director for New Bridge, Washington, which is the committee that is supporting Initiative 502, which would legalize, regulate, and tax marijuana for adults 21 and over. And we really appreciate you coming here tonight. We hope you have lots of great questions. Hopefully it'll be very interesting for you to hear from two people that you might not expect to sponsor and endorse and support an initiative like this. We'll first get to hear from Charlie Mandigo. Charlie is a 27-year veteran of the Federal Bureau of Investigation, and he was the special agent in charge of the Seattle Division from 1999 to 2003, during which time he oversaw the investigations of Ahmed Rassam, the Millennium Bomber, as well as white supremacists and lots of drug cases. And Rick Steves, many of you probably know, is one of our local celebrities grew up in Edmonds, Washington, and is the founder of Europe Through the Back Door. He's a successful travel writer and wildly successful public broadcasting producer. So if you have questions, when we get finished with Charlie's presentation, I'll remind you to hold them up and our volunteers will start collecting them. So we're just going to go through and make sure if there's a lot of repetitive questions that we're getting everybody's questions answered as much as possible. It's great to see so many faces here tonight. So without further ado, I think I'll ask Charlie to go ahead and come up and we can get started. Please give a warm welcome to Charlie Mandigo.
Thank you, Allison, and thank you, and it's good to be here to see such a big turnout. You know, I find it kind of strange to be here talking as a sponsor advocate for the passage of I-502. If somebody had asked me a year ago if I would do such a thing, I'd tell them they're nuts. That I, with 27 years in the FBI, you know, one of the two federal agencies primarily responsible for enforcement of drug laws, that at some point that I could come up and say that yes, our technical guys are absolutely essential. That, again, I would say, you know, that a year ago, somebody said that I'd be standing here this evening as an advocate for passage of I-502. You know, I tell them they're nuts, that they're crazy, that as a 27-year veteran of the FBI, an federal agency primarily responsible for enforcement of drug laws, that, hey, no way, after spending the career doing that, working major drug cartel cases, you know, dealing with across the board of marijuana, heroin, cocaine, and other matters. However, you know, that's really a knee-jerk reaction. When somebody says legalizing marijuana, you know, the immediate response is, you gotta be crazy, you know, and not looking at it within the context. And where I came around differently is looking at the context of I-502. I-502 presented to me a holistic way to look at what the drug problem is, as opposed to how the drug issue, particularly of marijuana, is being addressed currently within the federal government, local government, and other agencies. That one of the big problems from a law enforcement point of view, they basically are given what is almost an impossible task. That in order to control, you know, the use of marijuana, that you're looking at three things. You're looking at production, you're looking at distribution, and you're looking at demand. And certainly all three of those are very difficult topics. And from a law enforcement point of view, that it was really only looking at two of those. One was the production and the other would be the distribution. But what law enforcement really is not able to do and has never been able to do is address all of those hand-to-hand transactions that happen every day. You know, rough estimates in the state of Washington, there's about 365,000 people that have used marijuana within the last 30 days. If you break that down, that may be that every day there may be as many as 10,000 hand-to-hand transactions of a person purchasing marijuana on the streets. And there's no way that law enforcement can address that kind of a thing. And further, it's that cash that's being handed over to the drug dealer on the street that's driving the violence that criminal enterprises are engaged in. And if there is a way to take that money out of those hand-to-hand transactions, that it has the potential to reduce the violence that is associated with drug trafficking. the street gangs, the drive-by shootings that you see, the ancillary crime that people are engaged in. And what I-502 does look at this in a holistic manner, the whole drug issue, because it is looking at taking that money in that hand-to-hand transaction rather than going back into a criminal enterprise, going into a street gang. It's putting it into a business establishment that can be taxed and also business proceeds, and that money is going into legitimate business activity. And also the taxes, and this is one of the issues that can be addressed with those taxes, is that money can be used to address that demand side, that the education that can be used, that money for education on people on the use of drugs, on rehabilitation and other means, that currently where there are insufficient funds that are allowed for that, where most of the money currently, for drug prevention is focused in on the law enforcement side and not on the education side. And some of the benefits on putting marijuana under a regulated system is, well, look at the practicality. Has anybody ever heard of a street dealer selling marijuana to somebody asking for an ID if they're over age 21? I don't think that probably has ever happened.
No.
No. Currently, there's a lot to be learned, and I think that's what I-502 did. It looked at different programs and took some of the benefits of these programs have been learned on, for instance, on tobacco, on what has been learned by taxing tobacco and the ability to put warning labels on tobacco, the education of people so that they know the risk associated with the product that they're using. If you do a regulated system, where it's controlled, that it gives the potential to have quality control of the product so that the people are purchasing don't have to worry about contaminants. You also have a situation where that person that makes the purchase does not have the risk that they may run into violence in doing that transaction with somebody on the street. A best situation getting ripped off for the money or getting a product that isn't marijuana but something else or contaminated. So you avoid that kind of a violence. And again, coming back to the most essential point, that money isn't going into the hands of the criminal. It's going into a business establishment that can be taxed. Talking about tobacco, the current information would indicate that for students in school, it's easier for them to purchase marijuana than it is to purchase tobacco. And basically because for tobacco, somebody has to go into an establishment and show an ID and be able to purchase it. So it's at least going through one transaction where age and identified age has been established. Whereas for marijuana, there's currently nothing like that, and you can purchase it from a 14-year-old, 16-year-old, or whatever in a high school environment, or possibly the person sitting next to you. So there's some definite benefits, and I further like tobacco if you're selling it in a regulated establishment. Arguably, put warning labels on it is part of the process, similar to what you're doing with tobacco. So it does have some particular benefits there. And again, from a law enforcement point of view, this is a difficult topic because as I, with my career and many law enforcement officers, have spent a good share of their career, working, enforcing drug laws. But realistically, the passage of I-502, it doesn't affect law enforcement that much. That if somebody is outside this building selling 1 or 2 joints of marijuana, they still are in violation of the law because it's outside the regulatory structure of I-502. And one of the things that I see in I-502 is, people in law enforcement feel that it somehow is going to increase, the availability of drugs or have a bad effect, as far as youth or other things. But I see the potential for I-502 to work in parallel and supplement what law enforcement is doing from the point of view that if a person is making their purchase within the regulated establishment, that they're not in violation of state law, they're not subject to criminal arrest for doing that. But if they're making that purchase outside of that regulatory structure, they still are subject to arrest. And where the working relationship that I see can happen with law enforcement is that, hey, hopefully they're going to drive all of those street sales into the regulated distribution centers, and therefore drive all that money that's currently being in a hand-to-hand street transaction going into criminal enterprise. Again, it's going to go into the regulatory structure instead, where that money can be used for education, be used for rehabilitation and other things, as opposed to, street gangs buying bling, or, the money going south of the border, or whatever it is that money is being used for. The turf wars to control the territory, to sell drugs that leads into the violence. Straying a little bit over into another law enforcement topic is, some people have raised the issue about DUI and concerns about the level that has been sent for THC testing. From a law enforcement view, and as a parent, as an individual, my concern is that they're not impaired drivers on the highway. And a law enforcement officer, before they can pull somebody over for, suspect for whatever reason, the person has to be demonstrating impaired driving. And hey, if somebody is impaired driving, I don't care what it is that is causing them to be impaired, they don't belong on the highway. And, as far as, whatever it is that, hey, recently, a couple weeks ago, I had a shoulder operation and was taking Oxycontin. Hey, I knew I couldn't go outside and drive taking Oxycontin. It's a prescription drug. Now, what is the difference if you have prescription marijuana? It's not a license to allow you to go out on the highway and drive if you're impaired. And to me, the .05 level isn't really relevant. The fact is, if a person is on the highway, the law enforcement officer observes them driving impaired, they don't belong on the highway. Be it alcohol, prescription drugs, prescription marijuana, or whatever other reason it is that that person's an impaired driver. So, there's many things, and people look at it, and kind of repeating myself somewhat, but the whole thing that I see on I-502 is that knee-jerk reaction when people initially say, hey, we're going to legalize marijuana. And I-502, to me, is not legalizing marijuana in the common terms that people say it's legalizing marijuana. It's taking marijuana and putting sale of 1 ounce or less in a very regulated situation, a very controlled situation. But anything outside of that is still a violation of law, still something that the officer that is doing an investigation or observing can still arrest somebody. And so it's not leaving it wide open. It's basically leaving law enforcement in a situation where they can address the serious violations of marijuana laws, where you have the drug traffickers, the people that are bringing the drug across the borders, the people that are growing it illegally in our national parks, the people that are selling it on the street corners, the people that are selling it in schoolyards. Law enforcement still can do all of that. They still have that capability. And realistically, what have they really lost? All they've lost is if somebody is found in possession of 1 ounce or less, they can't arrest them. But otherwise, they can arrest them. If it's a sale, if it's within the nearest school zone, all of those other things still leave open for law enforcement to address. And again, that's why I come back to where I see I-502 does have the great potential of working in parallel with law enforcement, where we have law enforcement doing what it has been doing for the last 30 or 40 years, trying to address the cartels, the street gangs, and on the other side, we have I-502 taking that money out of the hands of people doing street transactions and keeping it out of the hands of the criminals. And hopefully what we will see in that is a reduction of violence, and the money that currently isn't available to government agencies, to other people, for the rehabilitation and the education of people as to, the possible hazards of using marijuana. So, I will kind of conclude with that, but again, I back up and say I find it kind of strange to be here at this point. As an opponent, as I would have been an opponent a year ago of any idea of legalization, and I think I-502, as indicated, is a holistic approach that no one ever has tried to do before on addressing the issue of use of marijuana. It's holistic because it looks at the law enforcement side, it looks at the production side, it looks at the distribution side, and most importantly, it looks at the demand side, the people that are using it, because it is addressing the education, the rehabilitation, and makes that kind of money available that's never been available before in the government's efforts to suppress the use of marijuana. And with that, thank you, and I will turn it over to Alison.
Can I have a quick show of hands of people who are just now taking a look at I-502 for the first time? All right, so how about if I give you the nutshell of what it is? And then that way you maybe will have an opportunity to write more in-depth questions. So you heard Charlie talk about the fact that it makes it legal to possess up to an ounce. That's up to an ounce of usable marijuana, or the bud form, the flowers, the form that most people smoke or vaporize. Also, up to 16 ounces or 1 pound of marijuana-infused products in solid form, meaning baked goods like brownies, cookies, that sort of thing. Some patients especially they prefer to eat it rather than to smoke it or vaporize it. And 72 ounces, or basically a 6-pack, of marijuana-infused liquids, teas, juices, things like that. That becomes legal for people 21 and over 30 days after Initiative 502 passes. You can no longer be arrested for being in possession of those amounts. At the same time, a 1-year rulemaking process begins, and by December 1st, 2013, our Liquor Control Board, in consultation with the Department of Health and the Department of Agriculture, will come up with regulations for how to control the supply side of the equation. The growers, the processors, and the retailers. Those will all have to be private Washington licensed businesses. The regulations the agencies have to come up with have to have security, sanitation, labeling, transportation rules, everything about where you grow it, when you ship it somewhere else, who gets to transport it, what kinds of lock containers they have to use, and lots of experts will weigh in on that. There will also be tight restrictions on advertising. Not only will advertising be restricted for all of the businesses that are involved in the marijuana industry, but the Liquor Control Board will be given the authority to come up with additional regulations on advertising, all of which have to be geared towards protecting youth from being exposed to advertising. The whole goal is for the marijuana industry not to target young people. As our experience has shown us with alcohol and tobacco, sometimes industries are wont to do. There will also be a restriction on public display. So you're not going to see people using marijuana in public, just like with alcohol. No public display of alcohol, no public display of marijuana. And our Clean Air Act that applies to smoking in public applies to smoking marijuana as well. So anywhere that you can't smoke a cigarette, you can't smoke marijuana there either. It does not change the medical marijuana law at all. Saying that, though, it does provide patients 2 new benefits, even without amending the medical marijuana law. Our medical marijuana law does not give patients protection from arrest or prosecution. All that the Washington State Medical Use of Cannabis Act does is provide patients an affirmative defense, kind of like self-defense, a defense that you can raise at trial after you've already been arrested and prosecuted for breaking a marijuana law. With making marijuana legal for all adults 21 and over to possess, we finally give patients protection from the fear and stress that they may someday be arrested and prosecuted for using medical marijuana. The second thing that it does is it gives patients finally a licensed, regulated, safe, secure source of marijuana that they know the quality of it, they know how it was grown, they know where it was grown, they know where that money is going. Finally, industrial hemp. A lot of people don't know about industrial hemp. It's not really something that we emphasize because, frankly, when people are talking about legalizing, regulating, taxing marijuana, they're not thinking about hemp. But hemp is important. And what Initiative 502 does is it redefines the word marijuana. Marijuana is defined in Washington, the Uniform Controlled Substances Act, as the plant, basically. And it redefines that so that the term marijuana only applies to marijuana that has more than 0.3% THC concentration by dry weight. That definition is chosen because that's the standard at which, For example, the Industrial Farming Act that's been introduced in U.S. Congress sets the dividing line between the intoxicant form of the cannabis plant, which we refer to colloquially as marijuana, and industrial hemp, which is a product that we currently import into the U.S. somewhere like $400 to $450 million, mainly from China, also from the EU, also from Canada. U.S. farmers can't grow hemp. And not to say that with I-502 you will start to see a huge agricultural domestic market grow. There are already about a half dozen states that have decriminalized industrial hemp. Until we get rid of the federal prohibition, there probably aren't a lot of farmers that are going to, put their farmland and their equipment on the line to see what the DEA does. But at least under Washington state law, industrial hemp will no longer be a criminal commodity. All right, now that I've said all of that, remember, fill out your cards. If you have questions already, go ahead and put your hand up, because there's a couple more things I want to tell you about, and our volunteers can take this opportunity to collect the questions that you already have.
Pass them down to one side or the other. It'd be really
Pass
helpful.
them down to the end of the grade.
Also, if you can look to your left and look to your right and see if there's an opportunity for you to scoot in and make a chair available, you'll notice there's a lot of patient people standing in the back that would love to take a load off. While you're doing that, the last thing that I forgot to talk about when I was up here earlier, how many people are into social media? Twitter, Facebook, yay! So, if you want to tweet about what you're hearing tonight, you can do that on our hashtag. I'm saying this very strangely because this is all new to me. A hashtag is for the 502 campaign is #502yes. You can also send messages. You can mark messages in Twitter for Rick at Rick Steves, and his team will know that you're talking about him and talking about this, and they can retweet stuff out. And you can do at New Approach WA as well to do the same thing. If you are on Facebook, come like our page, the Yes on I-502 page, and follow us on Twitter and do all those things that social media mavens know to do that I don't really know. But anyway, there you go. All right, now let's bring up Rick. As I mentioned before, Rick has traveled the world. He's got a great company. And he's a businessman, and I just think it's really cool that someone that is as successful as he is, that has built such a strong company, that has expanded, been so successful over so many years, is willing to take a public stand and come out and talk about an issue that for a very long time has been a third rail issue, has been very stigmatized, and that people are afraid to talk about because they think they're going to get labeled as a stoner and no one's going to take them seriously anymore, and they're not going to buy their fabulous hemp products or go on trips to Europe with them anymore. So it's really a pleasure to be able to stand alongside Rick and have him supporting this initiative. So please give him a warm welcome.
Alison, and thanks Charlie, and it's just great to have all of you together. We're just kicking off our 7-day around the state tour here, so it's fun to get on the road for this. We've been looking forward to this for a long time. I've got just a rundown on why I'm involved and why I think it's important, and looking for your questions afterwards. A lot of people just wonder how long have I been at this and so on, and I've been able to speak out a little more publicly lately. But I remember way back in the 1980s, I was on Chiron. I don't know if you remember Jim French. He was a big radio guy back in the 80s. And he needed somebody who could be the responsible businessman, who could go on to his show and speak up in defense of mature adult recreational marijuana use. And I thought I could do that. A lot of us who grew up in the 70s knew a lot of mature people that smoked a little pot. I thought at that time it'd be wise for me to have a pseudonym, so I was Jerry. And we talked about it, and that was fun. The next day I was up in Edmonds, just walking out for my cup of coffee, and somebody drives by, rolls down the window, and goes, "Right on, Jerry." All right. So much for anonymity. in the 90s, I bring a European perspective to this. So I employ 80 people up in Edmonds, and we've had a fun ability where we always list our favorite gelato flavor along with everything else we do in my staff. So people like fragola or pistachio or chocolato. And I would always just put ganja for my favorite, my favorite gelato flavor. Mainly because I just wanted to help Americans get over this fear of even talking about marijuana. Even to this day, people come up to me and all over the United States and they'll say, "I love your books and I like the other things you're doing." They can't even say drug policy, much less marijuana. So it's an odd thing, isn't it, that we haven't even been able to talk about this for so long, and what an impact it has on a lot of real people. So I've been speaking around the state, and back when Gil Pierlikowski was in Seattle Police Force, before he went to Washington, D.C., his right-hand man was sort of assigned to follow me and listen to what I had to say, so they knew what we were up to. And I got to be friends with this man. He's a beautiful man. He's just as concerned about, he's a good law enforcement guy. He cared about, public safety and what's going on with our kids and drug abuse and all that sort of thing. We became friends and had dinner, and I remember one time I was walking out of the restaurant with him, and he asked me, just like really candid and honest, "Why are you so into this, Rick? I mean, you're a well-off white guy in the suburbs. You and your friends can smoke pot for the rest of your life, and as long as you use a little bit of discretion, you can do it with impunity." And I told him, that's why I'm into this. This is a law that arrests 800,000 people a year in our country, and they're not rich white guys. They're poor people and black people. And we need to talk about this. So, it's a real problem for a lot of reasons. And the prohibition model has been tried. We did it before with alcohol, and it's a nice idea that you can just say no, but it doesn't work. So we've got a new approach. I want to stress, we're not pro-pot. We are civil liberties, we are smart law, we are anti-prohibition. All right, that's very fundamental. It's really clear to me, marijuana is a drug. It's not healthy for you. It can be addictive to certain people, and it's not something that should be promoted. It's certainly not for kids, and we believe if you're caught driving intoxicated by anything, they should throw the book at you. That's just kind of common sense. But there is a much more complicated issue about this, and that's what I'm working on. Now, there's a lot of reasons to be interested in marijuana. Alison mentioned hemp, and I've got one losing product in my line. It's the hemp version of our day bag. And we don't talk much about hemp, but I think hemp is interesting. I'm not that into hemp, but I just like the feel of it. It's very organic. And I've got a little hang tag in here that I wrote. It says, "Hemp is patriotic. Of all the bags on your next airplane ride, this hemp piece of luggage is likely the only one not made of petroleum products. If oil dependence is part of America's problem, hemp is part of the answer. Happy travels." I was going to think hemp will save the world. That remains to be seen. But I got busy. I can't sell them because that's too expensive. So I just give them away. No, I can sell them all I want. But I'm going to give them away for a little price. Just for the first one, they can tell me the answer. What is the Constitution of the United States printed on?
Hemp.
All right. Who said hemp over here? Somebody here say it? That was too easy. Everybody did. Okay, let's try another one. What does it cost to keep a human being in prison in our state for 1 year?
Too much.
Too much. Who said too much? It costs $38,000. That's a lot of money. And we've got 9,000 people arrested in our state every year. President Nixon was all pissed off at the hippies for opposing his drug law, so he wanted to get back at them, and their drug was marijuana. So we decided to classify marijuana along with heroin and LSD as what's the number one? Second one, right? What year did Nixon decide to put marijuana with heroin and LSD? 71. 71. Hey, what a hemp historian. All right. And so there's hemp, that's a part of the whole discussion, and there's medical marijuana. And there's very good reasons for medical marijuana. That could be it's a whole crusade on its own. And I've learned a lot about it since I've been speaking out, because there's a lot of heartbreaking stories about that and so on. But I'm into this for civil liberties. I-502 is interested in this for smart law, fiscal responsibility, public health, what's best for our kids, and just pragmatic harm reduction. So I want to talk about what 502 is all about. We've already defined what 502 is. I want to talk a bit about the reasons you might oppose it, the reasons to favor it, how it's the new Jim Crow, fiscal responsibility, my views on it as a civil liberty. Interesting, I'm sort of an internationalist, so there's trade laws that are interesting, causing people to decriminalize rather than legalize. I want to talk a little bit about how coffee shops work and then give you a rundown on how this election's going. You know the law. The law is going to legalize, tax, and regulate marijuana for people over 21. They can buy up to an ounce from something that we would think of as a liquor store. You know, it just sells marijuana, no advertising, it's got to be 1,000 feet away from schools, this kind of stuff. Strict DUI provisions. This is really important. And tax smartly. This is a huge business, a huge black market, the second biggest cash crop in our state by most estimates, below apples, all right? And all the money's thrown into organized crime and gangs and that sort of thing. We can tax it, and a nonpartisan, just number of countries in Olympia did the numbers, and they figured a very reasonable estimate, our state would make $500 million every year in tax revenue if we can take the crime out of this equation. Now, 40% of that would go to the general fund. That's $200 million. They can do with whatever they want. And 60% of it would go into related things, healthcare, drug treatment, teaching kids the dangers of drug abuse. This is pretty powerful stuff, if you ask me. Now, who sponsors I-502? I'm on it. Alison has sort of spearheaded this, and we're joined by doctors, law enforcement people, and treatment professionals. It's not the kind of stoners you might expect, you know, but it's just people who care about our community and who are courageous enough to actually stand up and say, wait a minute, let's talk about this. 5 years ago, ACLU and Alison and I got together and made this movie called Time for a Discussion. That's all it was. We produced a half-hour documentary talking about, shouldn't we be talking about this instead of the same old just say no kind of propaganda stuff. And we produced this beautiful half-hour show, and nobody in the Seattle media market had the nerve to air it before Girls Gone Wild. You know, we had to buy a half-hour advertising time, and basically we could run it at 2 o'clock in the morning because it just wasn't okay for us to talk about this issue. We're not promoting pot. We're talking about a painful law that needs to be looked at. Now, it's a complicated thing, and it's a complicated thing for me. I don't understand all the legal stuff and the DUI stuff that well, but I do understand the value of endorsements and smart people whose career is to care about people, and they've decided to stand by this thing. The Children's Alliance has endorsed it. That's 100 community service organizations in our community here in Washington State, designed to look out for the well-being of children and families. That means Catholic Community Services. That means King County Boys and Girls Club. 100 groups like that. They debated it for 4 months, and their board voted unanimously to endorse legalizing, taxing, and regulating marijuana. Not because they're pro-drugs, that's for sure. They're pro-kids. The NAACP supports this. Now, if you know how drugs have ravaged the black community, you could understand that the NAACP would be predisposed to be against any kind of drugs. Hard on drugs, it screwed up our community, let's get ourselves drug-free. And they've looked at it, and 2 years ago they came out in California, Prop 19, supporting the legalization, taxing, and regulating of marijuana because they recognized that the laws against marijuana were doing more pain to the black community than the marijuana itself. That's powerful to me. And the NAACP in our state has endorsed it. Doesn't matter what I think is good for black people. I want to know what the NAACP thinks is good for black people. I want to know what the Children's Alliance thinks was good for children. They're with us. Now law enforcement is with us. Seattle City Attorney, the former prosecutor from the federal prosecutor, John McKay, LEAP, Law Enforcement Against Prohibition, which is an organization of cops and so on that look at this. Now unfortunately, it's very tough to be employed currently and even say anything questioning the existing laws. So LEAP should be named really retired law enforcement against prohibition. Because it really is retired people that can speak the truth about this if you want to keep your job. But the fact is, these are sober, hardworking, committed people that stand by this law publicly. The status quo today, I mentioned 1971 Nixon kicked off the war on marijuana. We've spent $1 trillion, $1 trillion. Nobody disputes that, fighting this war against drugs in our community. We're arresting more people under Obama this year than ever before. 800,000 people, 90% of them for just possession. It's amazing. In our state alone, 9,000 people arrested. 45 and 1.6 million drug arrests in a year. 45% of them are marijuana related. Think about the bloodshed south of our border. 50,000 people have died. It's a drug war. Look at Old Country for No Man and multiply that by 1,000. That's what's going on. Pickup trucks full of a silly weed that our country is hell-bent on keeping illegal, and it's a bloodbath south of the border because we want it up here. We would pull the plug on that war in a hurry. We certainly would lower it if we decided to get smart about marijuana. Now I want to deal with some of the main concerns that people have, and I've been talking about this for a long time. There's just a few predictable concerns, and I just like to hit them straight on. First of all, most of the people who just have the knee-jerk opposition to I-502 assume use will go up. Almost all the concerns raised are with this assumption that use will go up. I'm convinced use will not go up. Every country has a track record on decriminalization. They find there's no correlation between consumption rates and the strictness of the laws. Seattle hasn't arrested a pot smoker for a while because we got I-75, making it the last priority for law enforcement in Seattle. Use has not gone up. They haven't arrested a pot smoker in the Netherlands for 25 years. And by every government's estimates, ours and theirs, our statistics are awful squishy on this issue because everybody has an agenda who goes to the trouble of making these statistics. So you got to look at both sides. Everybody agrees that American kids smoke twice per capita what the Dutch kids smoke. What's with that? It's almost legal in their country. It would be if our country would let it be legal, you know? It's decriminalized. And our kids smoke double. By every estimate, Europeans smoke no more pot, young or old, than we do here in the United States. And within Europe, there's no correlation between where is the pot smoked more, depending on the laws. Laws have nothing to do with how much is consumed, if people's track records are any indication. A lot of Americans think there's this reservoir of decent people who are people who would love to ruin their lives smoking pot if only it was legal. We could legalize it tomorrow, and you might see a little spike in use, and then it would settle down. People who want to smoke pot do. Most people have better things to do with their lives than smoke pot. And people who do smoke it mostly are doing it very casually and socially. And there are people who abuse it. We're not saying there aren't. And these people need to be thought of not as criminals, but as people who need help. That's the pragmatic, harm reduction approach that Europeans have that America has a tough time getting its brain around. A lot of people always say it's a gateway drug, though. You know, I know it's not that dangerous in itself, that one toke and you're on the way to heroin addiction. Well, the Portuguese people have a thing called Law 30. This is so interesting. I've been studying this for 10 years, and I get sucked into it. It's fascinating because it deals with so many real people, and it's an illustration of how so many smart people can be misled by just conventional thinking and so on. But you get a hard look at it, and it's just quite fascinating. 10 years ago, the Portuguese had a law called Law 30. It essentially legalized the consumption of all drugs. That was with a liberal government. Now they've got a conservative government, the 10-year review, and even the conservative government recognizes that this has been smart, a good thing for their society. It's not a gateway drug. What use has not gone up, and their hard addict problem has been cut in half. The Dutch and the Portuguese have done this progressive stuff about marijuana, not because they're soft on drugs, but because they had a real bad problem with hard drug addiction. And they realized if they could take the marijuana out of the criminal zone, they could deal credibly with hard drug addiction problems. Have you been to Amsterdam? You remember the Zeedijk area in the red light district there? Well, it used to be a no-go zone. It was so riddled with drug addicts and pushers. Now, I was there a couple months ago, it's gentrified. There's beautiful little boutique hotels and restaurants and cafes, and their hard drug taking population has gone down and it's aged. And their marijuana taking population is hanging out in little pubs, checking their email and blowing smoke rings. All right. It's just what they like to do. In the Portuguese system, they've learned that the only thing gateway about marijuana is its illegality. Because when it's illegal, people have to buy it on the street from a criminal who's got a vested interest in getting you hooked on something that's more profitable and more addictive. It just seems common sense to me, and this is what law enforcement people know in their heart of hearts, even if they can't say it. If you want to control something, the most misguided thing to do is make it illegal. If you want to control it, legalize it and regulate the heck out of it. Yeah. And then you can if it truly is bad for you, you educate people, and people are not just, interested in sending themselves in a downward spiral. We educate people. It's pretty exciting. exciting when you look at the European track record. A lot of people say, well, it's sending the wrong message to children. I-502 preserves all the restrictions against children. We're not legalizing and taxing and regulating for children. It's the same for anybody under 21. We're talking mature adult use. Very strict ideas, no advertising, obviously. You don't advertise pot, you shouldn't. And I would think we'd stick with that. In the Netherlands, they don't advertise pot. You never see a window display. It's never buy two, get one free. You know, I have to go to these coffee shops because I'm updating my guidebook to Amsterdam. And I walk in, and what I always do when I'm doing my research as a travel writer is I come in there like just a clueless English-speaking tourist. And I walk into the coffee shop. You know, they don't sell coffee in coffee shops. It's where they sell their marijuana. And I look around and go, how do I know what to buy here? There's no menu. And they say, well, we can't advertise it. If you want to know what's for sale, you can push that button. So I physically have to push the button, which illuminates the menu, and then I can see what I might want to buy. You see, it seems like legal hair splitting, but they've got a strict law in the Netherlands that they're not going to come to you with the advertising. You got to take the initiative to go there. You can't go into the place if you're underage. And when you go in there, if you want to buy it, you got to take the initiative. They're not going to be promoting it. That's thinking out of the box. It's not always right, but it's a heck of a lot better than what we're doing. Just say no, lock and lock. That kind of, you know, silly stuff that maybe we're trying once, but not 30 times. We're endorsed by the Children's Law. That speaks volumes when it comes to kids. I'm a parent. I helped raise two kids. They're in their 20s now. And I've been thinking a lot about this. And I think a lot of parents are in this state of denial where they think we don't want to have our kids have access to pot. If you're a parent, you know your kids have access to pot if they want it. They got access to alcohol too. You can say it's easier for a kid to get marijuana now than it is to get booze because, as we were talking about, you get it on the street, you can't buy alcohol unless you get carded and go to a regulated store. My feeling from a parenting point of view is it's not unrealistic or unreasonable to say this is an adult activity. Someday you can use a chainsaw. Someday you can drive a car. Someday you can fire a gun. And someday, if you want to, you can have a cocktail and you can smoke a joint. But wait until you're an adult. Pretty straightforward. You say that to the kid, you've got some credibility. If you parrot all this government reefer madness propaganda, your kids aren't going to listen to a single thing you say when it comes to the dangers of hard drugs. That's a real problem. The loss of credibility among parents, teachers, and law enforcement. I got teacher friends. During those DARE meetings, they can't utter a peep. It's just amen, yes, right on, or they're going to lose their jobs. We're getting nowhere with that in our society when it comes to kids being educated about the dangers of drugs. And a lot of parents are realizing these days that they just don't want their teenage kid to screw up and have a record. I mean, you know, there's serious issues here, and we've got to deal with that smartly. Bottom line, if this passes, it will not affect, in a negative way, how many kids smoke pot. There's no indication from the 17 medical marijuana states, where it's quasi-legal, if you want to take advantage of that system, that more kids smoke. There's no association with increased youth among kids in decriminalized states, in I-75 Seattle, or in European states that have decriminalized. Change in youth consumption is not related to the laws. A lot of people say, well, look at all the young kids that are in treatment for drug abuse. That's an intellectually dishonest argument, and anybody who says it should know that. When kids get busted, they got a choice. Harsher penalties or go to treatment voluntarily. Every kid's going to volunteer to go to treatment. You can't draw any conclusions from how many kids need treatment by how many kids are in treatment. I was just talking to somebody who's in the foster care program. A good percentage of the foster kids in our community are there because parents were busted for marijuana. Not because they were bad parents, but because they just screwed up and the law got them and now their family's in big trouble. Some people say pot is really strong now. It's a whole different thing than when we were kids. It's a funny argument for me. I mean, alcohol, gin is stronger than beer. It's both alcohol. You can get drunk on either and drive your car and hurt somebody. If marijuana is so much stronger today, I would say it's probably because it's illegal. Prohibition against alcohol drove our society from a beer-drinking society to a gin-drinking society. Other people say, well, marijuana is laced by all this poison and stuff. You don't know what they fertilize it in Mexico. We want to grow it here with control. We can refine it like wine, And when you think about prohibition, we can learn a lot from that. People were dying because moonshine was not regulated. It was dangerous. People are getting messed up with their health now because marijuana is illegal and you don't know its source. A major concern is driving. And man, I'm with it. I'm right with anybody who's concerned about driving with people, safety on the roads. This law, I-502, is very strict on DUI provisions because we just don't think there's any room for us to fiddle around with who's out there on the roads. If you're intoxicated by anything, prescription drugs, alcohol, or marijuana, if you're driving impaired, you're in trouble. Again, there is track records that we can learn from. 17 states have medical marijuana. No indication that there's more problems with the intoxicated drivers on the road because marijuana is more available in those states. There's not a spike of medical marijuana users getting in trouble on the road. So it's just a false sort of comparison. And as Charlie was talking about, a driver has to demonstrate impaired driving before they're going to be pulled over on this. So it's an interesting issue, but this law is very strict on DUI. I've got several dear friends of mine, and they just say, Rick, I'm not going to support it because I've got a friend who's really messed up because they've used drugs. To me, that doesn't equate because we're not saying more people are going to be smoking pot. We're going to be saying it's not going to be a crime to smoke pot. And when you make this law, suddenly the government no longer becomes your enemy, but it actually becomes an ally. That's what people say in Portugal. In Portugal, the word for addiction is enslaved. You're enslaved to that drug. And now, people who are enslaved to hard drugs go to the government for help, rather than hide from the government because they get locked up. Now, a lot of people always also say, what if the feds come and preempt this thing? Well, I've got to say that is pretty exciting. We don't know. And I would say that the federal government is looking for well-written laws that are strictly enforced and not abusing things. Law enforcement doesn't take a moral stand on stuff. Law enforcement has to enforce smart laws. Back in the Prohibition days, Mayor LaGuardia in New York said, any society that has a law on the books that it does not intend to enforce consistently across the board causes respect for law and order in that society to erode. Okay? We've got a law on the books now that people don't respect. There's no intention of locking up everybody who smokes pot. It's a fiasco, and it's confusing and I think demoralizing to law enforcement. Will the feds preempt? Well, 17 states have, in blatant opposition to federal law, legalized medical marijuana. I don't see that's much worse than what we're trying to do, to legalize tax and regulate marijuana for responsible adult use. What have the feds done in the last 15 years to medical marijuana dispensaries? In cases where it has been abused, they come in, and they love to come in apparently, and clamp down on it. But if you go within strict guidelines of smart laws, generally the feds will work with you. They don't have endless resources to be looking around for this kind of trouble. And I would remind you that the way our country is designed, states are incubators for change. It's a smart thing. You don't want the federal government to make a law across the board for 50 states when we don't know what's the best law exactly. We are designed so states try this, states try that. If it works, they make it better and refine it. If it doesn't, it fades away and they stick with the status quo. Alcohol prohibition was not dropped from the top down. It was an incremental state-by-state thing. One bold state tried it, another one did. Pretty soon the federal government realized the wisdom in that. And it's incremental also in what are the laws like. Originally, when New York, I believe, was the first state to legalize consumption of alcohol again, it was beer only. You couldn't have hard liquor. And there was no home brewing. And then they realized it would take a baby step further and a baby step further. Suddenly you've got all kinds of alcohol. You've got beer sold here, and in many states, hard alcohol would have restrictions. And you've got now the ability to home brew. Okay, so our law has no home grow. And that's frustrating to a lot of people. Well, that's an increment, and we don't think our community is ready for home grow yet, but we think we might be able to take baby steps in that direction when our electorate gets comfortable with the idea. The important thing when you're looking at this law is to recognize none of these laws are perfect from the get-go, but you got to do them. And then we have legislators who are designed to tweak these and make them work better for our communities. I've got little faith in our governor, the people that dedicate their life to this sort of thing. And in 2 years, it's quite easy to amend this and tweak it so it works better for our community. Historically, there is opposition to these legalized marijuana initiatives. And we can learn if we look back 2 years ago to California. California is the leader in this. And 2 years ago, they tried to do kind of what we're doing, but they had a more progressive law that allowed home grow and less restrictions for DUI and so on. And at the very end, the federal government threatened, which scared a lot of people. And what undercut the very likely success of California's Prop 19 was opposition, not from the center and the right, but from the left. It was opposition from medical marijuana, and it was opposition from people who sell marijuana illegally in Mendocino County area, in that area where it's a big, big business. So you got to wonder, what are the financial interests of people when it comes to the verge of legalization? Everybody can be on board, and then all of a sudden when you're almost legal, then you see the true stripes of people, and some people who don't want to lose their monopoly undercut that movement towards civil liberties and legalization. I don't know what's going on in our state, but I just think that this is a smart law, and it's so exciting to be working with my partners in this and help it work. I mentioned the new Jim Crow. I think this is a very serious issue, and I want to talk just for a minute about financial responsibility. It's a huge, untaxed, underground economy, enriching organized crime, and we're just completely turning our back on all that revenue. Prohibition against alcohol ended, I think, in part because of the Great Depression. We just didn't have enough money in our society to have an expensive law that was accomplishing nothing. I don't think it's any coincidence that we're on the verge of legalizing marijuana in our country today, just a couple of years after a great recession. The fiscal issue is a huge deal. And this law that we've got is fiscally brilliant because it raises money for taxes directed at drug abuse problems. And consider all the relief on our police department and our law enforcement world here in our own state. This is very expensive. Our friend Pete Holmes is the city attorney for Seattle. He's co-sponsored this. He's very outspoken on this, and he is one smart guy. And when he ran to be the city attorney in Seattle, another big discussion was how are we going to afford the new prison in Seattle? It's going to cost $200 million. Pete Holmes says, I know how we can afford it. We cannot build it. And if we stop arresting pot smokers, we don't need it. You know what? We elected Pete Holmes. We didn't build that prison. And the sky is not falling in Seattle, I can promise you that. It's just we don't track down these pot smokers. The civil liberty thing is very interesting. And with my friend, that police sergeant that was working with Gil Kalikowski, he didn't agree with anything I said except for one point. He said, I can't argue with your civil liberty stance on this. As Americans, we have the civil liberty to do what we want to in the privacy of our own home. Now, if we go out and break something, we get in trouble. If we go out and hurt somebody, we get in trouble. But if I want to sit at home, smoke a little pot, and just look at the fire pits for 6 hours, that's my civil liberty. I'm a kid-raising, church-going, hard-working, tax-paying American. And I firmly believe that the adult, responsible use of recreational marijuana is flat out a civil liberty. And I think our society is starting to see that, and we're polling at 57% right now, and I think people understand the beauty of that. It's interesting to follow these elections. In the 90s, it was all medical marijuana. It was on the West Coast, too. California, Oregon, Washington, Alaska. The people wanted medical marijuana because medical marijuana is real. It gives people relief. The legislators were afraid to do it, so the initiatives did it, and they went there, and now 17 states and the District of Columbia are marijuana states, and it's quasi-legalization. I like it in part because it gives the opportunity to test drive a legalization and regulation kind of program, and you see that, it's got its flaws, but it can be worked out. Now, 20 years later, we have the same kind of interest in going beyond medical marijuana. We're more comfortable with it now. We're certainly more comfortable with it now than we were 10, 15 years ago, I'll tell you that. It's almost counterculture to oppose us these days. And we're going for this legalized, tax, and regulate. And it's happening again in the West. This year, Oregon, Washington, and Colorado all have initiatives. It's interesting to me as an activist and our drug policy advocate because each state has played it a little differently. In Washington State, we have the most conservative law. No home grow, no changes for people under 21, strict DUI. In Oregon, in Colorado, they allow home grow. It's a little looser. And in Oregon, it's almost like the tomato approach. It's like you should be able to buy it like tomatoes, It's not quite like that, but it's more close to that. And the polling is just as Alison and the originators of this predicted. you know, we're at about 57%. Colorado's going to be close, and I don't think Oregon has a chance. So it's just what is our community comfortable with. We can try it, just go into the wading pool. If we don't like it, we can get out of the pool, or we can go a little more comfortable with it. If you want to learn more about this, we did this movie called Marijuana, Time for a Discussion. It's very easy just to Google Rick Steves marijuana and get all sorts of information. And you can go to the I-502 website, which has a wonderful trail of all the news reports and the talks and our different people who have endorsed it. I want to just stress once again, I-502 does not say marijuana is good. It says prohibition is an expensive, losing battle. And we've got to do something different. It's time for a new approach. And when you assess the issues, when it comes to I-502, please do not be hung up on this utopian wish for a drug-free society. There's never been a drug-free society, and there never will be a drug-free society. And frankly, I don't know if I would want to live in a drug-free society. Okay? Drugs are there. They can be respected, and they can be abused, and we can be smart. This law is not soft on drugs or hard on drugs. I firmly believe it's smart on drugs. Thank you so much. The new Jim Crow. I've let Alison talk about it. There's a book that's sort of the rage in this country among people who care about this, talking about how, you know, if you think that there's racism in our country, you can't just out and out disenfranchise people because of the color of their skin. But there might be a convenient way to make it so they can't vote and they can't have a decent place in our society. And one way would be to make them all felons, you know. There's more black people involved in our criminal system right now than involved in higher education. I mean, it is appalling. And, you know, people tend to lock up people because they want to be safe. We've reached that point right now. We've got so many people in prison. We incarcerate more people than any other civilized nation. 8 times the per capita incarceration rates as Europeans. My European friends look it up and they say either we are inherently more criminal or you got some goofy laws, you know. And the irony, the counterintuitive sort of result of all this is you want to be safe, so you lock more people up, you're making yourself less safe because you're putting nonviolent criminals into the prison system. They make lots of friends, they learn lots of tricks, they come out, they can't get a job. What are they going to do? They're going to be back in prison again. So this is a serious issue. And Alison, you might have a little more.
The book that Rick is referencing is Michelle Alexander, Michelle with 2 L's. The book is called The New Jim Crow, Mass Incarceration in the Age of Colorblindness. It's an excellent book. A great accompaniment to it that's a great, fairly easy read is Paul Butler, Let's Get Free, A Hip-Hop Theory of Justice. He was a U.S. attorney in Washington, D.C., and was actually caught up in the criminal justice system when a neighbor complained about him assaulting her. And he talks about how mass incarceration has actually made us less safe. That, you know, we think that by arresting people that's going to make us safer, and it's having the opposite effect at this point in this country. So, if you have additional questions, please go ahead and put your card up in the air.
Michelle's last name?
Alexander. Michelle Alexander.
It's on YouTube also.
Yeah, it's a great book. You all had fabulous questions, and if there are additional questions, please do. Most of the questions, and we organized them, there were a lot that were very similar. Most of them were a little technical about the initiative, so what I thought I would do is I would just quickly try to run through and answer those questions, and then just open it up, because you may have other questions that you want to ask specifically of Charlie and Rick that's specific to their experiences, and I want you to have full advantage of having these 2 gentlemen here tonight. And then please, if you have additional questions specific to the initiative, you can go to our website, newapproachwa.org. You can email us at campaign@newapproachwa.org. All of this information is available on the literature over there. We definitely want to make sure that we answer your questions, so if there's something that we missed tonight, please follow up with us. So I'm going to whip through these as quickly as I can, and then I'm going to try to get these 2 gentlemen talking again. Okay, if someone lives within 1,000 feet of a school under I-502, can they possess marijuana in their home? Yes, Any adult 21 and over can be in possession of marijuana anywhere because it is no longer a crime. And if it's not a crime, you can't be arrested for it, you can't be prosecuted for it. There is a new infraction of public display that operates just like alcohol, so you could not take that out, whether it's within 1,000 feet of a school or not within 1,000 feet of a school, you cannot publicly display your marijuana. How does I-502 give greater protection for medical marijuana patients while it is still illegal under federal law? Can a trooper not still place a patient under arrest for breaking federal law? Something that is not a crime under state law is no longer under the jurisdiction of a state or local police officer to enforce. The federal government cannot deputize our law enforcement officers and require them to enforce federal law. Now, we are not able technically and legally to protect medical marijuana patients from enforcement of federal law. That's always been the case. That's been the case since 1996 when California passed the first medical marijuana law. It is a policy decision that the federal government has made that it will not expend federal law enforcement resources going after patients, going after their providers. And more recently in 2009, the U.S. Department of Justice said that they would not go after people that were in clear and unambiguous compliance with state medical marijuana laws. So the only additional protections that I-502 provides patients is protections that they don't have under current state law. We will be giving them new protections under current state law by virtue of the fact that we're making it legal for any adult to possess marijuana, therefore eliminating the risk that they will be arrested. So talk to us about the tax structure and revenue. So Initiative 502 sets up 3 new licenses. There's a producer, the person who grows it, a processor, who is a person who, if the grower just wants to grow the plants and turn them over, then the processor could be the one curing the plant into usable form, bud form, or a processor could be the person that's making those edible forms of products. And then finally, the retailer. The same person could have both a producer and processor, grower and processor license, but there's a tied house restriction like we have with alcohol, so they cannot have a financial interest in the retailer to prevent vertical integration and monopolization of a market. So what happens is that there is a 25% excise tax that applies at each license point. Obviously, it's going to be a smaller tax in terms of the actual numbers of dollars at the wholesale level than it will be at the retail level, right? So it's not 75% at the end because you're not paying as much tax on the wholesale price as you are on the retail price. The reason for splitting it up like that is essentially where we wanted to get to at the end was roughly the level of sin tax that we have on alcohol. It's about 40%, and that's basically where you wind up when you have a tiered structure like that. It's also a good taxing strategy because by breaking up the tax like that, you avoid one chokehold in one place that encourages diversion of tax dollars. That's why we want to spread the tax burden out over all of the people in the supply chain. At the end, basically the new tax for the customer. Right now, medical marijuana dispensaries, to the extent that dispensaries are allowed to operate in any of our jurisdictions, and I think you probably know that's your mileage may vary experience in this state right now. But if you're in a jurisdiction that has medical marijuana dispensaries, those dispensaries are supposed to be paying retail sales tax right now. And in fact, our Washington State Department of Revenue sent letters out in December of 2010 to all the dispensaries they could identify and say, this is not a prescription drug. You can't prescribe it, so this is a product just like any other product, you have to pay sales tax on it. So the new tax for the customer under I-502 is really a 25% tax at the end. Right now, medical marijuana, on average, according to the Washington State Office of Financial Management that prepared the fiscal note for I-502, a gram of marijuana is selling on average for about $12 a gram. So in order for a dispensary, if they wanted to switch over and get a retail license, in order for them to absorb the tax burden and not pass that along to the consumer, they would drop that price from $12 down to $9.60, and then the regular retail sales tax would apply. So that's what the tax burden looks like in a concrete sense. The revenue is estimated to be, as Rick said, a little over $500 million a year, $1.9 billion in the first 5 fiscal years. Everybody knows that's the best estimate that we could come up with. Obviously, we've got the federal government. We don't know what the federal government is going to do. And we don't exactly know how a legal marijuana market is going to shake out. There's some questions about what about the black market? How in the world are you going to undercut the black market? Well, the reason we're going to be able to undercut the black market is because right now, marijuana costs about 10 times as much as it would cost as a legal product. In the Seattle market, it's about $200 to $280 an ounce. An ounce by weight is a little over 2 packs of cigarettes. That's a tenfold increase in price, right? If you compare tobacco to marijuana. Tobacco is harder to grow and cure, by the way, than marijuana is. The reason why marijuana is so expensive, the reason why it costs $12 a gram is because it's a black market commodity, and the people that are growing it and selling it to you are taking on enormous risk of being arrested, prosecuted, jailed, saddled with a conviction, being robbed by their competitors and not being able to call the police to come and help them because, you know, you're in the black market. And that's why it's so profitable to them, and that's why some of them are fighting passage of I-502. So we can definitely undercut the black market just looking at the supply side of the equation. The other piece of the equation that you have to look at is the demand side. People who smoke marijuana are overwhelmingly law-abiding citizens that just don't want to be criminals because they enjoy using marijuana. And if you give them a legal, regulated place to buy that marijuana where they know what they're getting, they know where it's been grown, they know what's gone into it, they know, how strong it is, what the cannabinoid profile looks like, and they know that their money is not going to Mexico, they're going to come to you and they're going to buy from you. I mean, if that weren't the case, Al Capone would still be selling us booze, right? I mean, right? I mean, and yes, there are some people that will go through the trouble to go and buy cigarettes somewhere where they don't have to pay as high as a tax. But overwhelmingly, people want convenience. People want to be able to buy something local and legal. What funds, will funds be used for rehab programs? Most of the funds are dedicated to healthcare and prevention. There are some that are dedicated to youth treatment programs. But what we did is we put 50% of the excise tax into the basic health plan and another 5% into community health centers. Because under our healthcare reform now, treatment is actually covered by healthcare. And we also know that substance abuse issues usually are connected to undertreated physical and mental health issues. I mean, not usually, but at least 50% of substance abuse disorders correspond with untreated mental health issues. So the hope is that we're taking a more holistic approach to prevention and treatment and tackling all the problems that go into substance use, including there's a Building Bridges program that gets funded. That is a program that sends money to community-based organizations and schools to intervene with at-risk youth to keep them in school, and then to actively go out into the community and find youth who have dropped out of school and bring them back in, because we know that keeping kids in school is one of the best things we can do to prevent them getting into trouble with substance use. How long are the funds guaranteed before it all gets shuffled to other funds? There are a lot of people that are worried about what happened with the lottery dollars, that are worried about what happened with other things, and that's a completely legitimate concern. Our Washington State Constitution requires a 2/3 majority to amend an initiative within the first 2 years after it passes. After that 2 years, it only takes a simple majority to amend. And so at that point, the legislature could shift dollars around. That's why it's so important, why we already are talking to people, especially in the treatment and prevention communities, about banding together and creating a strong coalition that will be working with the legislature to make sure that dollars stay where they need to stay. Two other features that we put into Initiative 502 to help ensure that that happens is, first, monitoring. The Healthy Youth Survey is a survey that's administered every other year to the kids in our schools to see what their attitudes are about substance use, risky behaviors, sex, alcohol, tobacco. And I didn't know this until we started drafting I-502, but that survey doesn't have dedicated funding to make sure that it happens every year. So there's dedicated funding for the Healthy Youth Survey included in I-502, as well as funding dedicated for cost-benefit analysis by the Washington State Institute for Public Policy, which is an internationally recognized policy think tank that is charged with advising the legislature on legislation that's before it. They're going to do an evaluation, and that, just the fact that they're doing that work should help give us the information that we need to protect dollars that are doing good for our communities. If some of the dollars need to be shifted, if the allocations aren't right, it's not the end of the world that the legislature moves those dollars around. We want them to go to the right places. But we're going to have to stay engaged. We're going to have to be engaged in the democratic process to protect the funding and make sure that it's having the outcomes that we want. If this passes, projected price of marijuana, we don't know, sorry. I think I kind of covered that with the black market. Oh, but best guess on quality of marijuana sold by the state. Just want to clarify that this will not be state-grown or state-sold marijuana. These are private businesses that are licensed and heavily regulated by the state, but no state employee will be involved in the growing, processing, or selling of marijuana. These are private individuals that are choosing to take the risk to get a license to do this. When I say choosing to take the risk, again, we can't protect people from the federal law. Just like the people who are growing and selling medical marijuana right now are taking a risk, so will people be that are getting licenses under I-502. The thinking is, we've got 1 year for a rulemaking process after this passes. We're certainly going to be having a conversation with the federal government between now and then, and we will have a sense, I think, by the end of 2013 of whether or not the federal government is going to allow the voters of the state to proceed with what they want, to try something new, to go in a new direction. But it won't be grown by the state. Answered that one. Will we actually be able to collect taxes? This is something people say, how can you tax a product that's illegal under federal law? It is a basic thing that most of us that went to law school learned early on, is that you have to pay your taxes on anything. You have to pay taxes on illegal income. That's what got Al Capone into trouble. You have to, if you are a gambler, you have to, and you're gambling even in a state where it's not legal, you have to pay taxes on that. The tax man always gets his dollars. And that's just the case. The Washington State Department of Revenue collected $750,000 last year from medical marijuana dispensaries in the state. Only about 50 of them paid their taxes, and they paid $750,000 in taxes last year. California has brought in millions from their medical marijuana dispensaries, as has Colorado. So everybody has to pay their taxes. And, you know, some people say, well, if these are going to be taxes from illegal activity, why wouldn't the federal government come in and try to seize them for forfeiture under the civil asset forfeiture law under federal law, for, you know, it's like proceeds of drugs? Possible. That's a pretty dicey political thing to do, for the federal government to come in and say to the state, I'm going to take your tax money away. Completely different for them to go after private licensed companies, right? And say, you are growing marijuana and we're going to take your property and we're going to take your profits. But I have a hard time seeing the federal government coming to the state of Washington and say, cough up those tax dollars that you received off of these products. Annual cost of prosecution for arrest, investigation, in courts for marijuana, roughly about 20 million. And the reason why we can only guesstimate that is that we get only itemized information from the Office of Financial Management. In other words, like, here's the average cost of an arrest, here's the average cost of a prosecution, here's the average cost. All told, it's about $20 million a year. Is there going to be a database with names of customers? No, you do not have to provide any identifying information. The same way you would buy alcohol from a liquor store, you would show your ID and you would get it. There's no database of customers. What happens when Vancouver police catch you smoking or in possession of under an ounce now versus after I-502? I can't speak specifically to what Vancouver police do, but what the law allows them to do is to take you into custody, book you into jail. A misdemeanor possession charge for marijuana results in a mandatory 24 hours in jail and a $250 fine if you're convicted. After I-502, none of that would apply as long as you don't have more than an ounce and you're at least 21. You could not be arrested, you could not be prosecuted, because it wouldn't be a crime anymore. And finally, and then we're going to turn it over to Rick and Charlie, what would be the effect on professional licensure, like for nurses, lawyers, folks like that? So it would no longer be a crime to be in possession of marijuana, so you would not be convicted for that under state law. And the federal government really doesn't go after people for just simple possession of marijuana unless you happen to be on federal lands, right? They don't spend a lot of time going after individual users, they focus on the big guns. But for some licenses, there is a separate issue about substance abuse. If you are in a healthcare profession or anything like that, you could potentially have action taken against your license if you were deemed to have a substance abuse issue, and that really is going to be a fact-specific issue within each individual. All right, enough of the technical garbage. Let's ask questions of Rick. Yes, sir.
Well, and what about these companies like Target or Home Depot or whatever that require drug testing? Will they still be allowed to do that?
Sorry, yes. Employment law doesn't change at all. So right now, our Washington State Supreme Court said that Even if you're a medical marijuana patient and you test positive, even if you're not in a safety-sensitive position, you still can be fired for testing positive. And that's in large part because it's still illegal under federal law. And with I-502, it's a big enough step in a new direction that we didn't want to try to tackle changing employment law around this issue as well.
If you come to work drunk, you can get fired too.
But would it be held to the same standard of THC?
It's the individual employer decision.
Yeah.
My family and I lived in Holland for a couple of years. When I tell people here in the United States what a safe and high-function society it is, in many ways I think better than the U.S. healthcare and whatnot, they say, well, it's different there. It's a more homogenous society, and you know this better than most. Well, how would you respond?
Well, it's not a more homogeneous society. The Dutch is a former colonial power, and it's got a lot of immigrants there and a lot of immigrant problems. The Dutch my Dutch friends just always, we get into these discussions, and they have a fundamental difference there. They tell me a society has to make a choice: tolerate alternative lifestyles or build more prisons. And they just like not to arrest a lot of people. They're very pragmatic. You know, the Dutch are not big pot smokers. There's no prime minister or whoever leads their government that's ever been a pot smoker. I mean, my friends tell me, all your presidents seem to smoke pot, and sometimes throw people in jail for doing it. And in our country, none of our leaders smoke pot. I mean, this sounds hard to believe, but Dutch people, they don't think about marijuana very much. Most people never smell marijuana. It's just, if you want to smoke, there's these kind of characters that like to smoke a little pot. They're down there next, some people go to the bar, and some people, I don't spend a lot of nights in bars, but there are people that live in bars, you know. And the Dutch have their coffee shops. I skipped over a little bit about coffee shops, and there was a question about who's going to supply this stuff. What's the backside? Well, the Dutch have never figured that out. It's called the gray area. It's just, they just kind of wink, wink, nod, nod, and it's a very complicated thing. We've got a very good shot at figuring out the gray area that the Dutch can learn from us, I think. But the police have decided just to ignore the back end and deal with the retail end. They have the cannabis cup there, which is, the different coffee shops to see who's got the best pot. Well, a long time ago, you might remember, pot came from Pakistan or Morocco, and they'd import it. I've got friends that run coffee shops in the Netherlands that I interview all the time, and it's just fascinating to me. And they say we don't import marijuana anymore. We still have the Pakistani kind, and we still have what you like in Nepal or Morocco, but it's all grown at home in these boutique little grows. So it's they handle that. There is this notion of decriminalization that no society has legalized, had the nerve to legalize. I forget if I talked about this, but the United States made a treaty in the United Nations. Did I talk about that? No. And I just learned about this at a drug convention I went to a couple months ago. Because I was wondering, what's with this decriminalization? Why don't they just legalize it? They decriminalize. Well, the United States created a treaty. Everybody in the United States had to sign it because it's you don't put your head down and vote. You have to vote with everybody looking, and nobody wants to get, a little country doesn't want to offend the United States. Everybody signed on, and the treaty says any country that legalizes marijuana, every other country needs to declare trade sanctions against that, you see. Consequently, nobody's got the nerve to legalize, but they will decriminalize. I'm sorry, forgive me, I've been talking all day long about this, but my friends in Denmark say, we got to be careful with your marijuana, we got to arrest a couple of pot smokers every year in order to maintain favored trade status with the United States of America. I mean, it's laughable unless you're the sorry couple of people that get arrested and they can keep trading with the United States. But, that's, in Seattle we put I-75, the lowest in law enforcement priority. So all this gymnastics, because you can't legalize, why? Because Nixon was mad at the hippies, or I don't know what is the reason, but our country's hell-bent on keeping it illegal. This coffee shop thing is so fun. A lot of people who are predisposed to be against marijuana say, well, look at the Netherlands, they're starting to roll back on their stuff now if you read the news. Well, they do have problems with drug tourism. Germany and France don't like their people going into the Netherlands, buying a lot, just going home with it. So the consequence is the border towns with the coffee shops have the biggest coffee shops in the Netherlands, and they're selling to foreigners. And so the Dutch government is being pressured to make it so you have to have a membership card to be a Dutch person to go to a coffee shop. And this is causing a lot of frustration with mayors. See, the federal government in the Netherlands wants to roll back because it's a right-wing government, a lot of pressure from the United States and different Christian moralistic groups and so on. But the mayors are the ones that are dealing with bloodshed and crime in their streets. And across the board in the Netherlands, mayors are in favor of the coffee shop system because it's pragmatic harm reduction. Any country that rolls back from a progressive coffee shop model or Christiania in Copenhagen to none of that, and they bulldoze the marijuana stands at Christiania, suddenly you got gangs selling it in the streets and you got murders in Copenhagen. They didn't have murders in the streets in Copenhagen for a long time until the developers started eyeing Christiania. They made the excuse that they're selling marijuana, let's bulldoze them. Suddenly you got criminals selling it on the street, you got violence on the street. So you can learn a lot from the European system, but bringing up the Dutch and their system, they're smart people, they're pragmatic people, and they just think. Actually, the Netherlands right now, they're renting prison space to the Belgians. They got these old prisons, they don't have anybody to put in them, so they're just renting them out to the Belgians.
Other questions in the back?
How can we help you? What can we do to help?
Boy, that's a good question. I just put that on my notes here. Talk it up. It's so fun to talk about this. I'm talking about it at my church next Sunday. We've got a special meeting, and I took my pastor for a walk, and I explained to him, there's nothing contradictory for me to be caring about social justice, what's good for our kids, crime, emboldening gangs, truth, civil liberties, Mexican Civil War. There's nothing unchristian about this, and it's scary for a pastor to get out on record on this, just because we're evolving. But talk it up in polite company. It's so fun to bring it up at dinner. And Alison, you can say how to help with I-502.
Well, I would interject one other thing too, is ask them, have you read I-502? I mean, I think that's a big stumbling block, like for myself, as I indicated. Hey, when you talk legalization, the knee-jerk reaction is, that's no. But once you get into I-502 and recognize how it is addressing the issue, then you begin to realize that this is a reasonable way to go about addressing the marijuana issue, the diversion of funds from illegal into business enterprises, and what Alison was talking about is tax. Hey, if you put it into the legal system, into a business, the federal government's going to get their share of tax anyways because it's income. So the federal government shouldn't complain.
In the back. Yes.
Yeah, with this being Vancouver and Portland and Oregon, this being right across the river, now I-502 passes and we get state-run stores or whatever selling this. Now, would only residents of Washington be allowed to frequent them, or what happens with anyone out of state? Would they be able to buy it?
It's a geography question. So any adult 21 and over that's on Washington soil will not be committing a crime if they're in possession of an ounce. You buy an ounce in a Washington store and you take it back to Oregon, you have to deal with Oregon police, not Washington police. Yeah.
Interstate transportation of an illegal substance. I don't think this has been thought out, folks. We're going to open a can of worms. You've said that we're going to reduce court costs. If you lower that threshold to 5 nanograms, the police will stop everyone.
Well, let's talk about that.
Yeah, does anybody know what 5 nanograms is?
Do you, but hang on. You have to remember what our DUI law already says. What our DUI law already says is that you can't drive drugged. What our DUI law already says and what the Washington State Constitution already says is that you can't be stopped without evidence of a crime. And the evidence of the crime the police officer has to have to stop you is impairment. So the police officer has to observe impairment, it can pull you over then, and even then, they may suspect it, but they've got to develop enough evidence independently to get to probable cause to arrest you. Then the next step is a breathalyzer, right? They can take you for a breathalyzer, and only if it turns out you're impaired, but your breathalyzer is so low that it's clear that you're not impaired by alcohol, then under current Washington state law, they can take you to a medical professional and have your blood drawn to see whether you're impaired by marijuana, by OxyContin, by methamphetamine, by whatever it is. The police officer will never know what your THC level is. The police officer is getting no new tool in his or her toolkit, because what happens is that vial of blood that the police officer has taken him or herself off the road for 2 to 4 hours to take you to the professional to maintain the chain of custody, that vial of blood is going to the Washington State Patrol Tox Lab. Then it's going to sit there
The police officer is going to send the paperwork to the prosecutor, and the prosecutor is going to decide whether or not to charge you with DUI. And only then will the prosecutor pick up the phone, call the tox lab, and order a test that's going to cost the state money that you may or may not pay back, depending on whether or not you get convicted. And then that test will come back. So there's nothing at all that changes for the police officer in the field, because that officer is not going to know that test result. So it's not going to change anything at all that's happening. Right now, people are getting charged with marijuana DUIs for less than 5 nanograms, for no nanograms of active THC at all, but only for carboxy, the inactive metabolite, the one that shows up in your workplace drug test and gets you in trouble, even when you haven't smoked for 3 days. That's totally separate than what the DUI standard is in 502. The DUI standard in 502 is only for active THC. So the only way that policing would change at all is if police decided to start breaking the law. Start breaking DUI laws, start making unconstitutional, illegal arrests of unimpaired drivers. That would be the only way that our DUI enforcement would change in this state.
They have the ability to stop you without impairment. If you have a license plate light out, they can pull you over.
That's true, but they can't
If they smell
arrest you.
marijuana, they can detain you. If they can't do a breathalyzer, they will have to arrest you
No,
and
because-
take you to a station to be tested.
No.
You say the court costs will go down, incarceration will go down. How can you say
Because
that? when-
possession of marijuana will no longer be a crime. So it will no longer provide probable cause to smell marijuana. The only way they will
No,
get to
you're not
probable cause,
addressing the impairment. The police will believe that you are impaired.
if they're lying,
I'm
if you're
gonna
not
tell you
impaired,
right now,
they won't.
I use marijuana. The last time I was tested, I blew 480 nanos. I use
Not of
about-
active THC, you did not.
What?
Not of active THC. Are you confusing active THC with the
I'm
inactive
talking about
metabolite?
my blood test
Okay,
for
well, let's,
positive marijuana.
you know what, let's have this conversation afterwards, because I don't think everybody here wants to hear us talking about DUI for the rest of the
No.
night. So are there any other questions for either Charlie or Rick?
I think the intent of my question was something you just mentioned, is the inactive THC that stays in the blood after impairment,
And in terms of employment?
and in terms of.
Right, that's a great distinction to make. He's asking, you know, for those of you that aren't familiar with it, there's a fact sheet over there. Oh, sorry, okay, all right. I'll try to be really fast. With the per se standard in 502, it distinguishes between active THC, which is the component in marijuana that actually causes intoxication, causes the feeling of being high. There is a metabolite, an inactive metabolite, THC, COOH, usually referred to as carboxy THC. That's the metabolite that will stay in your system for hours, days, even weeks after your last use if you're a heavy user. The per se standard in 502 applies only to active THC. What trips a lot of people up in the employment context, and I think the basis of your question about whether this will provide any additional protection, is that there are some people that will use marijuana Friday night. If they get called in for a drug test at work on Monday, they will turn up positive for that inactive metabolite that might still be in their system and face unfortunate employment consequences. And 502 doesn't change that. What it might change, what we can hope it changes, is maybe the culture and the understanding of impairment, and understanding that it's active THC that causes impairment, not the inactive metabolite, and it's not necessarily fair to penalize employees for testing positive. Yes?
Do you have a copy, an actual copy of the initiative?
I do in my binder. It's 64 pages long, so we didn't print out a bunch of them. But there is available on the website. If you go to the website and you go to initiative, down at the bottom, there's a link to a bookmarked PDF, so it's got kind of chapter headings so you can navigate it a little bit easier.
Repeat the question.
I'm so sorry. She asked if we had copies of the initiative here with us tonight. We do have a couple of staff copies that we're happy to flip through with you, but they're 64 pages long. And so there's a PDF on the website that's a little bit easier to get through because it has headings. Yes, sir.
Is it reasonable to shift the so-called gateway problem of marijuana from the drug to the gateway experienced by the people, the ambitious, smart people who see all this money moving around and say, I want a piece of that, and inject themselves into the distribution system and then become criminals themselves and subject themselves to the dangers of turf wars the farther up the ladder they move.
So, are you asking whether 502 is likely to encourage
No,
more
it's
people
not
to,
that
I'm
it's
sorry.
possible. Just change the character of the argument against gateway problem with marijuana. That it's not a problem with drug progression, it's a problem with criminality progression.
Oh, thank you.
Yeah, well, that's what I was told by my friends in Portugal. It's the thing that's gateway about marijuana is the fact that it is criminal, because then it gets rid of all the money. The gateway is a profit incentive thing, and there's that interest, and it's a it's a complicated thing. It's something that is so healthy to have this conversation, and we need to experiment with constructive ways to educate people and get the money out of it, and get away from just the same old propaganda.
A harsh statement on that, if you want to talk about gateway drug in the minority community because of turf wars, you say, yeah, it's a gateway to the cemetery.
Yeah, well, that's,
I would like to find out what this situation would do to holistic medicine and the effect of smart laws and diseases. If marijuana were used as holistic medicine.
I think, so I believe the question was, what about the holistic medicinal uses of marijuana, and would this have an impact on that, or?
Well, how would it affect the holistic medicine approach? In effect of what it does and does not do, but in coalition of what the smart laws say and don't say.
Right, I mean, essentially what 502 does, I think, is it actually starts to make it easier for us to do important research about marijuana's usefulness. One of the big problems that we've had with being able to study the potential medicinal properties of this plant is the federal prohibition on it, which makes it very hard to do research. There is some amazing research happening in other countries about all the different cannabinoids that are in the plant. And hopefully by starting the dominoes falling here in Washington, we can speed up the process of the federal government lifting the prohibition and allowing more robust research to happen. I want to take a note at this point because it's 8:30 and you've been an absolutely wonderful audience and we really appreciate you being here. We'll hang out for a little bit longer to answer questions, but I wanted to let you all know that there are awesome historically relevant T-shirts available for sale and buttons as well over at the table on the side. You'll never see these again, so get them while they're hot. And thank you so much. If you'd like to ask questions of Rick or Charlie or me, please feel free to stay. And thank you again for being here tonight. We really appreciate it.